Hello again. It's been a long time since my last video update. So long so that I've managed to grow a beard, probably a couple of times over. Um, so I'm up to now round 11 of 12 I've completed of my chemotherapy. And yeah, I think the reason for the delays in my treatment is because I've struggled a lot more, I guess, in these past 1 or 2 months with my treatment. Haven't been particularly motivated to do things like videos or breathe. So it's yeah, I was really feeling like I was coping quite well in the first 3 or 4 months of the treatment, and it's just gotten a bit harder towards the end. I thought it would get easier, thinking that you're nearing the end of the treatment, but I guess the symptoms and the side effects accumulate. So I was having two drugs, chemotherapy drugs, one called 5-FU and oxaliplatin. So I was taken off of the oxaliplatin because one of the side effects is peripheral neuropathy, where you get loss of sensation in your hands and feet mostly. So I was taken off of that drug after 7 rounds, I believe. And yeah, but those symptoms have continued to get worse. So they stop you before you get permanent nerve damage. In this latest round, my side effects were really bad. I had severe abdo pain, nausea, really lethargic. I was just wiped out for a week of just going to bed really early, like 7:30 at night, and sleeping during the day as well. And yeah, and also quite a bit of diarrhea, which again made me even more lethargic, just feeling wiped out. So I got to the point where I was just feeling like I didn't want to continue with the treatment at all. I've only got one left, but when I was in that stage of just feeling so unwell, I wrote a letter even to my oncologist saying I don't want to bother with having the last round. And yeah, so it's interesting when you're in that funk, I guess, just feeling like you won't get through it. And it gave me, I don't know if this is a bit of a stretch, but I think a bit of insight into what it must be like to have depression, because just when you're so deep in that feeling, it's hard to see anything beyond your current situation. But it's interesting that once you're on the other side of it, you suddenly gain some perspective of your situation, and even though it was quite bad, you feel like you can go on, you can continue, and you can go in for another round. So I feel like this cancer journey's, I guess, given me a lot of insight into these different illnesses, and perhaps preparing me, giving me more understanding and empathy, sympathy towards patients with these conditions. Perhaps not pregnancy though, although I was thinking how I've had my belly cut open a couple of times, so perhaps it's a bit like the cesarean section. I remember that in the early stages of this cancer journey that I'm on, I was feeling quite optimistic, and yeah, just going through the processes and feeling like everything was going to be okay. And now I guess that I'm approaching the end of my chemotherapy, I'm starting to think a lot more about the next stage in this process, which is more scans, further surgery for my colostomy reversal, and I'm starting to think back more again to those times when I was in hospital, and again just how bad they were. So I'm really starting to not look forward to these scans, having concerns that I'm going to be riddled with cancer, and having surgery complications. Yeah, it's started to bring back memories of those times when I was in hospital, and yeah, again, just feeling like, thinking at the time, this is just a place that I never want to be again. You think when you're in hospital, I don't want to go through this again. And then slowly over time you forget about those things, and but now that I'm coming back the other side, and the potential of returning to hospital, I'm starting to think more and more about them. So I'm trying to stay positive, and I've had some good discussions lately with a couple of people. One lady recently who's been on this kind of cancer roundabout a lot longer than I have. She gave me some very encouraging words and some good insight into how long this journey can be, and the reason to stay strong and get support from family and friends, and just having good motivation, I guess, to continue in what you're doing. Also, my one of the oncology nurses as well gave some good encouragement. So, thank you, ladies, for your support. I've got a bit of a project that I'm working on at the moment, which is good in helping to keep me motivated and working on something. And we're building a small or tiny house here in the village that I live in, and it's the project's called the Happy Simply Home, and it's all about an education model, just teaching people that building skills for one, but also showing people that it's possible to live in a tiny house. This one's going to be 10 square meters, and that not only it's possible, but it's I guess how most of the world probably live, rather than these mansions that we have here in Australia. So it's a volunteer project, a community project, and we're getting a lot of materials donated, and it's been a good project for me just to communicate with people, and when the build starts in a couple of weeks' time, certainly learning some new skills. So that's keeping me very busy at the moment, and if you'd like some further information about that project, you can check out the links that I'll put in the comment. So I'll try not to make it so long between updates next time. So thank you for watching, and I'll see you next time.